Welcome to Realizing Resilience, a podcast from the Connecticut Women's Consortium. We're not behavioral health professionals, but we're your gateway to real conversations with the experts. Each episode, we'll delve into the vast landscape of mental health, from personal stories to expert insights. Together, we'll bridge the gap between clinical expertise and personal experiences, connecting with diverse voices and perspectives. Join us for insightful conversations that demystify the world of mental health.
Anthony Nave is a dual licensed independent clinical social worker and licensed drug and alcohol counselor with a master's degree in educational psychology and clinical social work. He is advanced certified in EMDR, an EMDRIA approved consultant, an NBCC approved clinical supervisor, and holds an ICAADC certification. With over 17 years of experience, he has led educational and clinical services across all levels of care, working with clients from adolescence to older adulthood with co-occurring disorders. A seasoned national and regional presenter, he specializes in co-occurring disorders, grief and trauma recovery, and adolescent treatment. Anthony is the co-owner of the Healing Space Therapy and Consultation Services, LLC, and co-founder and chief clinical officer of Waypoint Cooperative, LLC.
Erin is a licensed clinical social worker who holds a master's degree in social work with a focus on community organizing, planning, and development. She is advanced certified in eye movement desensitization and reprocessing, EMDR, and is an EMDRIA approved consultant. Erin is experienced in addiction, trauma, grief, and prenatal and perinatal dynamics. Erin is currently in private practice and recently co-founded and is the CEO of Waypoint Cooperative, an incubator and community space for professionals in the mental health field looking for additional support, professional development, and a space for practice.
Anthony and Erin will be leading Mourning and Healing, Integrating Care for Grief and Trauma Recovery on September 12th. Welcome back to Realizing Resilience. My name is Alana.
And I'm Marisa.
And today we have the pleasure of speaking with Anthony Nave and Erin O'Neill. So thank you so much for joining us.
Thank you for having us.
Thank you for having us.
So first and foremost, why is it important for clinicians to understand grief and trauma as an interconnected thing? And what new insights and approaches are they going to take away from your training that is in September?
Well, I could start. This is always our issue is who goes first. One of the big things in this training specifically, but also in a lot of our work, because Tony and I do a lot, we do a lot of similar things, and there's a lot of overlap in our work too. But one of the big things in terms of trauma and grief is that all trauma is going to have a grief component. Not all grief is traumatic, but to that end, a lot of the expressions are going to be similar. So when someone comes in for therapy or family and friends are trying to figure out how to support someone, this is going to be helpful and to be able to understand what some of the expressions are, what is functional, what is supported, and where might additional support be needed. So this can look like if anyone here has experienced anything like grief, especially because grief is everywhere and grief is pretty constant. But, you think about lack of sleep or too much sleep or lack of appetite or eating for comfort or isolation versus being around people all the time. And people can get really caught up in the expressions. And so I think it helps to look at that overlap to understand where certain things might be coming from.
For me, in my experience, I know that when we talk about trauma recovery, and Erin and I will use this theory a lot by Dr. Judith Herman and the 3 stages of trauma recovery. Her first stage was safety. My biggest takeaway from learning about that theory or from my own experience is that safety is not just the actual, okay, let's get away from the threat and danger. Of course, that's part of it. But I think the other part of it, of getting a sense of safety, is understanding what's going on for you internally. And I think there is a great deal of overlap between grief and trauma recovery in the sense that we forget a lot of the grief, and if we're practicing name it to tame it to try and help people get a sense of safety to understand what is going on with me. Not everything is always a symptom or always part of a disorder. And I think a lot of the experiences that I have with clients when they're learning and discovering and figuring this out is that there's a lot of grief paired with trauma, as Erin was talking about, whether it's the grief of I don't get to have the childhood that I wanted, or the grief of realizing and accepting I'm not going to get the parents if my parents were abusive that I always wanted, or the grief of that's a lot of lost time to be stuck in fight, flight, freeze and never really knowing what the hell is going on in my life. And now that I'm aware of it, it sucks that I lost that time because I'm doing better with relationships now. So there's an aspect of the healing process that's hey, let's name and tame it. That's grief. let's not call that a symptom. You're not broken. This is not something to fix. This is just something to experience and start integrating a relationship with over time.
One more thing that I would add to that point too is in our training, we go into some of the neurobiology around grief and trauma and what's actually going on in our nervous systems. And I think the benefit of that is to understand ourselves and so that we're not constantly pathologizing ourselves anyway. I think culturally and societally, it's constantly like, when are you going to get better? What does improvement look like? And it's like this upward, supposed to be this upward trajectory where a lot of times, particularly with grief, even with trauma, it's not about improving the way the rest of the world thinks that we should be. It's about being able to identify how do we start to integrate this so that it doesn't define us and we can connect with ourselves and the rest of the world in a different way. So I think some of these things around whether it's identifying expressions, the neurobiology helps to get a better sense of what is going on with ourselves so that we are not boxing ourselves into something's wrong and continue to kind of collapse inwards.
Yeah, I think that's a conversation we have with clients. I have with clients a lot, is the insight or even the ability to name it is not the fix. It's the experience, whether it is trauma recovery or grief recovery, it's the experience is what leads to the ultimate healing. So even though you may want to rush to solve it like a puzzle, like, oh, I remember all those things that happened to me now, and those were tough, and now it's going to feel better. It's not necessarily the medicine or the therapy or the treatment. It's more the experience of my body, my mind, and my relationships feeling that all at once within my window of tolerance. And then over time and action, I start getting to rewire those circuits and get to a place where I'm viewing the world differently through a more resilient belief or narrative and less about the negative belief about myself that I was previously.
You just dropped some really good tidbits, both of you, of how healing isn't linear and how not everything is a symptom. Thinking about your trainings and the courses that you guys do, could you briefly break down the frameworks that you'll use, like interpersonal neurobiology or Worden's 4 tasks of mourning, things like that?
Yeah, I'll go first because that is always in the background of everything for me in particular. And I think Erin uses it a lot too. But interpersonal neurobiology is for me, more of a framework or like an underlying belief system of how do we grow or develop as human beings, less so than let's pop it in for an intervention or something specific. I think for me, it was, I started in my career in education, so I'm very attachment oriented. And then when I got into social work and doing therapy, I was constantly kind of looking for something for the bigger picture and be doing it in practice and not necessarily knowing what I was doing. So when I got to get to IPNB and I had a supervisor was like, hey, read this. This is matching everything that you're working on. It clicked for me. So having that background is helpful for me when case conceptualization, for understanding the timing of when to introduce interventions, understanding what we're trying to do ultimately as a goal for healing. If I'm struggling with grief or with trauma, essentially my ANS or my autonomic nervous system is in fight, flight, freeze, and I'm out of my window of tolerance all the time. So my goal is to try and get back into my window of tolerance and then widen my window of tolerance and ultimately just have more mental flexibility. So I'm not just responding to everything in my life in 1 or 2 or 3 ways. So IPNB, at its core, it's this understanding that my 3 primes of how I develop as a person. I have my mind, I have my technically brain, but I'm going to interchange body in that because our nervous system is our whole body and it's easier to just digest it that way. And then our relationships, the interplay, the communicating between my mind, my body, and my relationships, that information flow and how I integrate that information dictates how flexible I am mentally. And if I am struggling at any point, I'm going to take that roadmap that I have as a clinician for me. Okay, mind body relationships, this client's sharing their story with me. I can start seeing there's barriers between someone's nervous system, whether it's PTSD in their mind leading to negative beliefs, or if it's someone struggling with grief or addiction or something, I can start seeing the barriers between the relationships in their mind and relationships in their body and not getting accurate information there. And I can start picking out different treatment plan interventions or different theories or models to help improve that dialogue between those three. So interpersonal neurobiology for me is an understanding of how does our mind work, how does my body interact with my mind, how does my body interact with my relationships, vice versa, everything around, and how do I get the information flow between the three going again, and then pick and pop and choose which intervention fits best for this client's process or healing journey.
And so going off of that, which like Tony said, is kind of like the background framework of a lot of the work we do and how we approach healing, we use William Worden's 4 tasks of mourning and Judith Herman's 3 stages of trauma recovery in this training specifically, but again, as different frameworks and different lenses for our work. There's an awful lot of overlap. They don't necessarily look at things really linearly. So we talked about William Worden's tasks of mourning. We're most familiar, I think, with Kubler-Ross's stages of grief. But the thing that we like about these two is we're looking at trauma and loss as disconnectors. And ultimately, healing is about reconnecting to ourselves, to other people, to the world around us, whatever the case might be. And so Worden's tasks, the first one is acceptance, which always sounds so easy, but is much more difficult in execution and can shift, right? Like I could have somebody that I love die and be 10 years down the line and have accepted it in my day-to-day, have a dream, and it still takes me 30 seconds when I wake up to go through that all over again. And so that acceptance stage and those 4 tasks recognize that this is a cycle. So there's the acceptance, there's moving through pain, which is to Tony's point about that window of tolerance, or some folks call it window of transformation, is about widening it so that we are not completely overwhelmed by the emotions associated with grief all the time. We have to be able to feel it, but we're not going to be able to jump headfirst into the deep end of that pool and be able to like just stick it out. So it's going to be, how do you start to feel it in kind of bits and pieces, widen that window so that you can work with it, experience it, but that's not the only thing that you experience, because when we're trying to shut out that emotional pain, we're also not able to experience anything else. And so then we move into the third task, which is about readjusting. And this is not just adjusting our worldview, this is adjusting our relationship to the loss. And I use loss specifically because loss is more than just those who have died. We experience loss an awful lot, but so it can be the relationship to that person who has died. And this looks like different traditions that we keep going, or the way that we honor them, or some people talk to them. So there's different ways to kind of start to adjust. And then we've got that reconnection piece. And like I said, it's not linear. So you don't have to fully be in acceptance to then start to move through pain. You could technically be in all 4 tasks at the same time at different points. So those are the 4 tasks. And then Judith Herman's 3 stages are, as Tony mentioned earlier, the first stage being about safety, which is similar. And we talk about some of this overlap in our training, but about moving through pain. How do you start to widen that window, be able to tolerate, experience some sense of safety so that you can feel, so that you can then process, which is the second stage. And that's really where the grief and mourning component comes into Herman's stages. And then the third one, again, being about reconnection. How do we reconnect to ourselves? When we've experienced trauma, a lot of times we are really cut off, not just emotionally, but physically. So how do we start to establish that safety internally, start to feel again? And then how do we translate that into relationships with other people in the world around us? So those 2 frameworks are ones that we use both individually, but also there is so much overlap that it's hard to talk about one without the other in this context.
That's the beauty of IPNB when talking about those two, and understanding why things are not linear and why it's tasks that are being worked on simultaneously. Because if I understand the neurobiology behind death, loss, grief, we're looking at attachments in the sense that my brain is going to go through bonding with people and develop a lifelong relationship with that person. And so my brain is physically going through changes, creating a new neural pathway and network for the meaning and understanding of that relationship. That process is not meet someone, we're good. That process is meet someone, experience different things through my body and nervous system as I'm going through that, and then trying to analyze that in my mind and get an understanding of meaning behind the story. And then at the same time, my relationships is releasing a ton of signals for my body to release chemicals like oxytocin and everything in between. But all 3 of those things are simultaneously happening, that information, that pathway. So being able to accept the reality of a loss, yes, is a mind concept. I'm like, okay, this person's not here, but my body still has a neural pathway that is yearning or has despair for the attachment that was always there. And I recently went through a grief training that had a good example of, like, if you've had a room design in your house for so long, you get used to that floor plan. Your physical information of the sensory of the shape of the room, the objects, the color, the room temperature is body, part of that triangle. Your relationship to the space is, this is my home. And then your mind interprets that and creates a mental map of what that relationship and the physicalness of that relationship was like. The same thing happens when we lose something, like a job, a community, a relationship, go through divorce, or we have the death of someone. That person's gone, but that physically, but then everything that my mind took time to build and map out and create and crystallize a pathway is still there. So now I have this conflict of, yes, I can understand someone died and I attended the funeral, but then my mind still has that attachment neural network of that relationship still going. And I think the danger in grief, when we think of it socially, is that a lot of people are like, well, you get 3 days off from a corporate standpoint, or you get 2 or 3 weeks from a life standpoint, and then other responsibilities kick in to figure this out. But that's not what my brain is going through. I have a conflict right now between my mind and current information saying that person's not here, but then having a mental map of that whole relationship and a physical blueprint from oxytocin and dopamine and different things being released by that relationship. I remember that, but I don't have access to it anymore. And so I don't know this new pathway. I'm like, what the hell is this? I don't know which direction to go. And so that process of figuring out how to integrate both the reality of what's happening right now and that new information and the old experiences in my memory network and story and journey so far of that past relationship, and blending them together, is what we think of as grief or mourning, and which is unique and universal to everyone. But when we start getting through struggles, there's different various factors for that, and we'll talk more about that training of risk and protective factors. But there's different reasons why someone may start struggling with creating a new pathway that holds space for both of those realities. Okay.
And the frameworks are really helpful as a reminder that it's not only not linear, but there's not a finish line. This is something that is forever, that we're working on integrating as to be a part of us. I said this before, but like not be the only thing that defines us. But it's a reminder that this is something that adaptation is about healing, but healing isn't like, all right, I've hit that mark. It's been a year, all's good, rainbows and butterflies, but it's something that is going to constantly be, maybe not, and hopefully not as acute as it was right in that moment, whether it was a traumatic experience, a death, or both at the same time, but that this is something that is going to be constant. And I know for some folks that can be really scary, but it can also be reassuring that while society might have its pressure that you're supposed to be fine, that you not being okay is not problematic. Again, that's not something, like, that's not a symptom. That doesn't mean that like you're not okay, like you're broken in some way or you're doing it wrong. It's just that this is a process. When you think about what folks are experiencing, why would you be? So I think the frameworks really help with that as well.
So I don't think you talked a little bit, well, actually quite a lot, about connecting mind and body, and I don't think EMDR comes up in this training, but both of you are advanced EMDR clinicians and consultants. So I assume that kind of carries your work regardless of the direction. I actually don't think we've talked about EMDR on this podcast before, so if you could give like a little overview and then maybe talk about how that helps inform your work with trauma and grief.
He's my consultant, so I'll defer to this.
Oh man, I was gonna see what you were gonna say.
I'll chip in, don't worry.
So EMDR is a type of therapy often associated with working on trauma recovery. I think now, as we've done more research, people can see it has it's helpful for anxiety and mood disorders and other things. But I'm going to focus on the trauma aspect of it. So I think, before I even talk about specifically about EMDR, any type of, for my understanding, my experience, any type of trauma treatment, essentially we're trying to activate that memory network, the implicit memory network, which is the emotion of the story, or the 5 senses, or the broken images, sight, sound, smells, that kind of aspect. Because when you go through a tough experience or traumatic experience, it's the information starts its normal process, but then there's a level of dissociation that constricts it, or it keeps you stuck in fight, flight, freeze to a point where you don't get to finish the memory process, essentially. So it gets stored incorrectly, right? So any trauma treatment, essentially at its core, is going to trigger you or activate you intentionally in a safe environment while within your window of tolerance to reprocess, to re-remember, reshare, or experience that memory again within and store it correctly in long-term memory. So it goes from the implicit memory of the emotions, the stories, the sights, sounds, senses, mixes with explicit memory, which is the who, what, where, when, why, comes together in your new part of your brain, your prefrontal cortex, through your hippocampus, and becomes a narrative, a story where you can figure out the beginning, the middle, and end, and time travel correctly, and understand the meaning of it, or make a meaning of it, or take what you want and leave the rest, and be able to file it away later. When you have PTSD, it's probably a very like brief version of this, like that ability to mental map or understand the difference of what's the past, present, and the future is not there because that memory wasn't filed correctly. So using something like EMDR as a trauma treatment, we're going to activate that memory network. And what EMDR does is add bilateral stimulation as you're going through that process of remembering or trying to remember or triggering your body to remember it, because this trauma is stored in your body and we're activating it through your sights, sounds, smells, sensations, and helping you stay within your window of tolerance with the bilateral stimulation, which is it seems like a really fancy word, but like you're either tracking a light left to right, or you're tapping your legs or tapping yourself or looking at 2 points on a wall left to right. And there's lots of different theories of why that helps or doesn't help. I think for me at this point, I know some people will talk about REM or rapid eye movement and like wider association during REM sleep, and that's what we're replicating with BLS. But I think for me and my understanding, my experience is that is almost like a coping skill in itself to track something, to stay present with the light and less focused on the memory and the sensations for just a little bit. And so that helps you stay within your window of tolerance enough to let the body continue to work out what's stored there and talk to your mind and start placing the time, the who, what, where, when, why there enough to not get to get constricted outside your window of tolerance and short circuit all over again. Basically, the goal is like, I want to go through EMDR because I want to go see The Exorcist like it's the 20th time I've seen The Exorcist versus the first time I'm seeing it every time. Like, I don't want to go to the scary movie and not know what's happening or not understand it and feel that experience over and over again. And that's really what PTSD is. It's that echo, that constriction of like, I'm reliving this all over again, even though you've been through it. It doesn't feel that way. So EMDR is meant to help you understand it's a rerun.
Yeah. Our system essentially, when it experiences something traumatic to the point where it gets stuck, is reacting normally to a very abnormal set of circumstances. Like anything else, I mean, EMDR care comes in when we get stuck there and when it gets stuck in our nervous system. And so bilateral stimulation is supposed to help move it from right side of our brain that doesn't have narrative language, it doesn't have chronological time, like to the left, so that we can tell the story and we know it makes sense in time. Not that the event itself would make sense, but in terms of like this happened then, so that we can be here. And it essentially, ideally, helps us to get unstuck so that we can process the way that we weren't able to at that time for survival reasons and be able to reconnect. That's gonna be the theme. And so like to your other question about how it helps with this particular work, I mean, it is a trauma care modality, so that's kind of self-explanatory. Where we've used it in terms of grief is, one, if it was a traumatic experience in that grief, so if I had to watch somebody die, or if it was like this vicarious, like something like that, a traumatic loss, we can use that for the same reasons, but you're essentially using it to help someone get unstuck. So if they're stuck in, I should have done something, I should have known, like that's what comes up a lot too, is like those negative cognitions of we should have done something differently, I should have known, I should have said this. We can focus on where they're stuck there, help to release it, process it a bit so that they can continue to grieve and process. So really where you're going to use this isn't, again, to pathologize grief or that process specifically. It's really a modality to use when someone is completely stuck in one space. They could be having intrusive thoughts, nightmares about it over and over again so that they can process that through and then continue the process.
I think it's a key point that Erin talks about. That's a symptom. The negative belief about yourself after going through these experiences is the side effect, the symptom, the short circuit over time of staying constricted too long in fight, flight, freeze.
Yeah.
Like going through experiences when you're in childhood, it's easier for someone to believe it's their fault or they brought that on. Because as a kid, it's scarier actually for me to believe that I have no control over the situation, which is the reality. You don't often have control of the situation because you're dependent. You don't have all the skills. You don't have all the ways to take care of yourself. But it's easier for me to think that I brought on this or that as I'm growing up. So I have some kind of predictability to something that's very unpredictable. So it feels a little bit more in my control. And so those negative beliefs do take shape through grief, like through experiences of death and loss. Yes, the traumatic ones like suicide or accidents or like someone over months or days with cancer or different treatments, like those can be traumatic or they could not be. But a signal to us while we're going through treatment is if someone keeps saying, I should have done this or I could have done this, and it keeps it doesn't go away. Like, yeah, then we start shifting gears. Okay, this is a little bit more than just processing grief. We're gonna have to add some more support and view this experience as traumatic as well. Let's take this intervention to try and get us to a place where we can integrate everything and have more mental flexibility around it.
We've had EMDR trainings that have been kind of like room rented in these offices. So I've been around these types of things, and I'm not a clinician myself, nor am I in the behavioral health profession. So I had like a general idea of what EMDR was and what it was about. But that exorcist like analogy, really? And I was like, yeah, absolutely. That makes so much sense.
My wife's totally into scary movies, so am I, but far more than I am. So it helps that, like, all right, this is how it's relatable. Like, you want to get to a place where you understand what you've been through as a rerun and not the first time every time. And because I'm not going to take away the pain or the hurt from your experiences, but I'm going to get you to a place where you understand it happened back then. I'm okay now. It still sucked, but I'm not like, it's not a magic wand to make it go away. We're just decreasing the intensity and your ability to understand where you're at in the current moment.
The whole point is so that it's not emotionally triggering on a day-to-day, hour-to-hour, moment-to-moment basis. Which is the desensitization part.
Yeah, absolutely. Switching a bit from your training that's coming up to how you've recently co-founded Waypoint Cooperative, which is a place for professionals in the mental health field to get support and participate in professional development. What inspired this idea, and what was your vision for this kind of space and what it will be like for mental health professionals?
I can talk about for me. And so there's 5 of us who've co-founded it, and we've all worked together and or have been friends at different points in our life. And so one of
Or
the
married.
things that, or married, yeah, not us, should specify. But yeah, so it's a really good group with a lot, like a very wide range of skill sets, perspectives, ideas, and really what kind of brought us together and thinking about one of our co-founders who like kind of called our initial meeting was having a place like goof off because we enjoy each other and not have the pressure of supervision or we need to be doing this or whatever the case might be. And so what kind of came together from that was that in our own personal experiences, mine included, is that there's such a focus on our clients for an obvious reason. But in such a focus on that, we lose sight of what clinicians are experiencing and their growth, their support. And a lot of places also don't have the resources to support clinicians the way that I think that they would like to or that clinicians need. And so we wanted a space where people could feel cared for and kind of take a breath and relax and enjoy, but also get, whether it's supervision, it's support, a place to work, insight into different modalities, like not just from us, but from whoever else might join the group. So the idea that, and Tony has like a really great way of describing it, so I'm going to let him talk about it, but basically this like kind of community center and community of clinicians that can just be focused on clinical needs without the, hey, we need to talk about care plans or how you're doing your notes, or like leave that to the agencies or wherever people are and really be able to just focus on the clinician.
Erin's hitting it on like our main goal. Yeah, the five of us could have gotten together and started a group practice or like, let's focus on doing this, but that wasn't our true intention. It was more to let's create a space that's focused on community. Like, again, going back for me to IPNB, like relationships are important. That's one of the key experiences that leads to me finding my full potential. Like, I do better with people where I feel comfortable and safe, and allows me to explore and try different things. And if I'm going in a great place, then that's as an effect, my clients are doing better because I'm in a more curious space. So they're able to get what they need because they're able to match off me being in a more regulated type of headspace. And so my biggest thing is I don't agencies need to do what they need to do. They have their own constraints and different things, and we all have those experiences. So there's nothing bad against that. It's just they have their system. I wanted to say, okay, let's wipe all this away and create a system that's almost designed to be an incubator to help healthcare professionals grow. And so what do we need to do that? We need people with different backgrounds and experiences. We need people to help feel comfortable and safe. And also the expectations are, I want to meet you where you're at and I want to live it that way. So if you're a more developed or seasoned clinician and you just need to like rent office space and be around people because private practice can be pretty freaking siloed and you can feel alone working with clients all day, then let's work next to each other. And so we can have those hallway conversations or have different times where we can meet and connect. And like we started a peer support group that's just there once a month to help people with clinicians, just whether you want to complain about what's going on or to consult some cases, we're there. Or if you need more support in that regard, like, yeah, I'm just graduated, I need to be supervised and work in a space where I have licensed people under. So, okay, come work for us. And it's a different setup than an agency. We have a ton of different experience. You won't be tied to just one supervisor. You got the five that started the company from different backgrounds, or you got people that are already a part of our community that we can consult or share with. Like, let's meet where you're at and match your strengths. And so that's, I wanted to just foster and build a community that's like, all right, I feel comfortable growing there, whether it's like office space or more support and I need a job, or whether I want to do a training and I want to try that and grow in that way. So I'm like, okay, we've got experience doing that. We can consult or help you out and set you up to like take off on your own and feel like you don't have to do it solo or never do it because you didn't want to do it alone in the first place. Like, I always thinking of attachments for me, because if you got a healthy attachment, it's like taking your kids to a birthday party. If your kids are in a good space with you and you have good relationships, they might hang out around you at the party a little bit because they're nervous, but then eventually go explore knowing that you're close by. And so I wanted, my mission for Waypoint is that it's that incubator, it's that secure base for people to come wherever they're at in their life and their career and get what they need to be able to get to the next space they want to go. And so that's my goal. And I think that's a different environment, different aspect than agency work, because agency has other goals they need to work on, and your personal professional goals don't always align with where they're trying to go. And that's okay. That's nothing bad against agencies. There's actually nothing wrong with you if you don't fit at agencies. Let's go find a space where you do. And that's where my hope is for Waypoint.
I feel like that fills such an important gap because I know that's something we struggle with, and because we don't necessarily have the time and resources to create these spaces for people to just build community. And something that, like, I do our newsletter, I've tried to get people to respond and share strategies. It's really challenging outside of the scope of your normal practice and day to want to contribute to something like that. So for it to be kind of built in is really incredible. And I have friends who are just starting out who like just graduated, and there's so much uncertainty about, who do I reach out to for what? So that aspect is really exciting too.
I think for my experience in different roles, whether it was manager to clinical director and everything in between, right, was that the pressure to know everything or where to go to get it. And I think that gets isolating. And so I wanted to do the inverse of like, I know where I feel the most comfortable to figure that out. And I don't have to figure that out on my own because I'm in this community that can help us figure it out together. So I don't know if you call that a think tank or more just like I feel in a healthy place with a village of people that have some ideas or know where to go get the ideas or find the right people that do. And I wanted to be a space for someone to be like, I don't know how to start a private practice. Like, well, I got a bunch of people that are doing successful with it. Let's go there just for consultation. Or like, I don't want to get work for you. I'm like, great. I don't want you to work for me either. I want you to be happy. Like, what do you want to do? Like, I want a comfortable space to just be yourself.
Yeah. And to that end, I was going to say it's something different because it's not like we have a specialty in terms of who we work with, whether it's clinicians or our client base. Like that's one of the wonderful things about like these co-founders is everyone has such a diverse range of skills and perspectives and things that they're looking to do for their own careers, and how supportive I have felt. And I've worked with a couple of them for a long time, but how supportive I felt just in this space, and to want to give that to other people, because those are the things that anyone will say, whether it's in an agency setting, people going from private practice back to an agency or group practice will say like the thing that they missed was people. They miss like the collaboration that comes with, hey, I've got this case, and being able to pop into someone's office and ask their opinion. And so we really wanted, and from my own experience, those are the things that get you through bad days, or through those spells where you're wondering whether or not you are good at this, or you need someone to reflect off of or talk out loud to, is to just have that built in. And you can find your people, you can find the person that you collaborate with the best, or you connect with the best, and just have that kind of be an open channel of communication makes such a difference in our practice and what we're able to give clients. And clients feel that. I've had like just in our space, the number of people who have come in and have been like, this is a really nice space. That someone recently was like, there's good vibes in here. I was like, there are good vibes in here.
Well, thank you both so much for taking the time to talk to us and covering so much ground in the time that we had. We really talked about a little bit of everything. So thank you for sharing all of that. It was wonderful information.
Thank you both. We appreciate it.
No, grateful. Thank you for having us.
Yeah, and we're excited for your training for sure.
Same here.
Thanks.
Links will be in the description to sign up for Mourning and Healing, Integrating Care for Grief and Trauma Recovery on September 12th, and to learn more about Anthony and Erin. Check out our links below to keep up with us at the Connecting Women's Consortium. Thank you for tuning in today, and we'll see you next time. Thank you for tuning in today, and we'll see you next time.